Hello, my name is Amy Jenkins. I am a librarian 3 at the Upper Marlboro branch of Prince George's County Memorial Library System. Today I am here with Tiffany Thomas, and we are going to be talking about mental health issues that involve children. It's really important sometimes when we talk about mental health issues that we tend to stray towards the adults, but today we're going to talk about how children's mental illnesses matter. So Tiffany, I'm going to talk a little bit about yourself and introduce you. That Tiffany is the Program Manager of Education and Outreach at the Mental Health Association of Maryland. Since 2015, Ms. Thomas has coordinated the Children's Mental Health Matters campaign, where she establishes and maintains partnerships with schools, community organizations to meet 3 goals. 1, to raise public awareness of the importance of children's mental health and substance use. 2, to help to reduce stigma of mental health. And 3, to connect families, educators, and providers throughout Maryland with resources to support children. She is also a youth mental health first aid instructor in the state of Maryland. Welcome, Tiffany, to our conversation today.
Super glad to be here.
Great. Tiffany, one of the things that Prince George's County Memorial Library System is proud of is being a community champion for the Children's Mental Health Matters campaign for the past several years.
Yes.
In your opinion, Tiffany, what does it mean to be a champion?
A champion is someone or an organization or a school who signs on to help become an advocate for children's mental health. They are our boots on the ground in the state of Maryland to help raise awareness and reduce stigma around children's mental health, whether that's in their school, in their community, or within their organizations. They are people who help us spread the message of the campaign and help us to reach families and children to help educate them about what's important about taking care of themselves and taking care of their mental health, because their mental health is just as important as their physical health.
Well, absolutely. You're very true in saying that children's mental health is imperative. So mental health is such a big issue, and what if we're talking to parents and breaking things down into simple terms, not medical jargon, which a lot of people don't understand, but how would you describe mental health, and how would you explain that kind of topic to a child?
So the way that we encourage parents or caregivers or an adult in a child's life to explain what mental health is to a child, or even to ourselves and remind ourselves as adults, is that mental health is how we think and how we feel and how we act. And a mental health disorder affects an ability to work or carry out other daily activities or engage in personal relationships with one another.
So often the times it is Tiffany, when people talk about mental illness, they understand, like, if you broke your arm, you can see a cast, or if you sprained an ankle. But when you deal with the topic of something that's mental health, it seems to be a harder concept for people to understand what exactly it is, because there are, as we know, behaviors associated with it, but it's not as easy of a topic to grasp.
Yeah. Mental health disorders are harder to identify, like you said, and we say this often. This is kind of like a slogan per se that we've used in the campaign for a long time. It's easy to know if you have a fever or a broken bone, but mental health problems can be harder to identify. And the tricky part about that is knowing the kind of behaviors are moods that are typical for the stage of development that a child's in. So it's really important to know what is typical and what's not typical for the stage of development that your child or the child that you're working with should be in.
Good point. So, what are we talking about when we're talking about how common is mental health with the youth or children population?
So the prevalence of mental health disorders in children and youth is estimated to be about 20%, affecting children of all ages and ethnic and racial backgrounds living in all regions of the United States.
That's a lot of children.
That's
like saying 1 in, what is that, 1 in 5?
1 in 5.
1 in 5 children can have a mental health problem. Wow, that's really, really significant of a number. Then if we have 1 in 5 children walking around with these kinds of mental illnesses, what is the impact as a result of that?
So mental health conditions are chronic conditions, or can be chronic conditions. So it's really important to know that early intervention is crucial. They can last a long time and often don't go completely away. They go up and down in severity and symptoms, and can continue throughout the lifespan. So without that early intervention and treatment, children with mental disorders can sometimes have problems at home that can carry into school. It can carry into forming friendships and other relationships in their life. And they can, the mental health disorders can also interfere with their healthy development and causing problems that continue into adulthood.
That's really, really significant, especially when you're dealing with a youth population of trying to detect these kind of symptoms when sometimes children themselves don't know what to say.
Yes.
And how does a person who doesn't have a history of dealing with mental illnesses come to grasp with what the child is trying to say? So it brings the question then, what do I know? What should I know to reach out for help, or where should I reach out for help, or how do I know if it's serious?
So, like I mentioned a minute or two ago, it's really important to know what's typical or not typical for the stage of development that the child that you have or that you're taking care of is in. So the milestones that your child should be meeting for the age that they're in, it's important to know what those are and to be paying attention whether or not that they're meeting those. And to be paying attention if their behaviors, whether the way they're feeling or the way that they're acting or the way that they're thinking are affecting meeting those milestones. So those are really good indicators as whether or not you should reach out for help. The symptoms of mental health conditions can change over time and over that time as a child grows. And so that ties into development too. And those difficulties can impact how a child plays and learns and speaks and acts and handles their emotions. So the way that you see that in a 2 or 3 or 4-year-old is different in how you would see it in a middle schooler and how you would see it in a high schooler and so forth. So it's just really important to start paying attention to symptoms. They often start in early childhood, and some disorders may develop in a child's early teenage years. Diagnosis is often made in school age years, sometimes earlier. Some children with a mental disorder may not be recognized or diagnosed as having one. So the key here is you know your child best as a parent or a caregiver, and you can be the best advocate. If you're worried about your child's emotions or behaviors, you can start by talking to your friends, your trusted friends or family members. You can talk to your school counselor. A school counselor is a great person to reach out to. And then, of course, your child's pediatrician or family physician about your concerns. Those are the best people to start with. Your child's pediatrician can connect you with somebody in the provider realm if they too are concerned moving forward, to connect you with more behavioral health resources.
That's really good to know that information. And especially when you're talking about looking at, as the difficulty with play language and how they act. So some people would say in the old system, they would say, shake it off. And if that was such an easy thing, we would be doing the Taylor Swift
Yes.
and shaking off mental illness. But we know it's not something as simple as if it's something that somebody can do without any kind of information and whatever, and snap your finger, people would do it. But it's not quite as simple as that. So for those people who don't know, Tiffany, how are mental health disorders treated?
Well, there are many different types of treatment options, and they're based on the best and most current medical evidence. So you have to do the research yourself to find the one that fits best for your family, and best for your child. So again, be the best advocate for your child and what your child needs. Parents and doctors and every adult in a child's life should work closely together to find that best option for your child. So teachers, coaches, therapists, and other family members, and take advantage of all the resources and information that you can take in to find that best option for your child, and work together to make sure that they can find that success. And it's not going to be a one shoe fits all for every child. Every child needs a different plan. Every child needs different supports. It's not going to be the same for, Susie over here and Timmy over here. It's going to look different because disorders are different. The signs and symptoms are different. The things in their lives look different, and the support systems look different. So you have to work together to find out what's best. The other thing to consider here too is that we're in the middle of a pandemic. And so we have telehealth services, and a lot of folks are utilizing telehealth services for their mental health, and you can utilize that through your insurance coverage as well. So if you have questions about that, reach out to your insurance company. You can also talk to your pediatrician or behavioral health services about that.
And it's interesting that you bring up the issue of telehealth, because sometimes when we talked in my last conversation, how having tele is a different option that allows people to have a different form of contact. So as having different options can be beneficial to the population to reach out. So what can parents or caregivers do to support their children's or child's mental health?
So first, I want to say that the whole experience in the beginning can be extremely overwhelming and confusing and scary. Not knowing where to go and where to start, what to do, how to support your child, depending on what your child is going through and what you're seeing, it can just be extremely overwhelming. But it's really important that you as the parent or caregiver, stay in tune with yourself and advocate for your child, and you speak up when you know that your child isn't feeling right, so that together you can find the next steps and figure out the next steps to get the treatment for your child. The earlier you do that, the better, because early intervention is key. Early intervention is such an important piece, because the longer you wait, that means the longer that child has to wait to get the important tools they need to success, to getting the supports that they need to feel that they are empowered, to feel like they have control over what's going on. There are so many important tools. So the next step is to be open and listen to your child. You can do that when they're little. Let them talk about their emotions. Let them talk to you about how they're feeling. We have lots of tools on our website that can be downloaded and used, have them do a coloring sheet where they draw a face about how they feel. Oh, you're feeling sad today. Can you tell me the reasons why you're feeling sad? It's as simple as that. And then you emulate that as well. When you're talking, if you're feeling that emotion too, you can share that with your child. It's okay to talk about your emotions with your child. It's really okay. When you practice that, they'll also practice that too. They're going to do what they see you doing. So your children look to you for support and reassurance. Listen to them when they share how they are feeling, and you accept how they feel and give them comfort and support. Find out what's going on in their life. When they come home from school, check in with them. Ask them specific questions instead of just, how was your day today? What made you feel happy today? What made you feel worried today? Be specific, because that makes them think a little bit harder than, how was your day? It was fine. Give them something a little more to think about. Those are some practical ways to support your child's mental health. Start those conversations at home and reach out for help for them.
I think the one that you mentioned that resonates with me the most is expressing your emotions. Mm-hmm. So often emotions are hidden, mm-hmm. and it could be maybe because an adult wasn't raised to express their emotions, or maybe some people think it's a sign of weakness to show, and maybe if you're happy, that's okay, but if anything else is kind of going on, it makes you less of a person to try to deal with emotions. But you're right, children are looking towards the adult as to be the role model to emulate what they do. So if parents are more apt to do it, the child, you're right, is going to learn that it's okay, that I can express these emotions too. And you're right in the sense, it's good, healthy not to bottle up something, because we know if things are bottling up that they're going to explode. It's just a matter of time. So I think that's the point that you spoke about that resonated the most with me. So what are some ways that families can cope with stress and anxiety they've experienced and build resilience and practice self-care?
So you said the word resilience, and a lot of people hear that. Some people know what that word means, and some people are like, "Ooh, what's resilience?" And so resilience is one of those words that is what's the word? I can't remember what it is, but it's a word that's floating around the mental health community right now. And I just want to take a minute to explain what it is. So resilience is the ability to bounce back from stress and adversity or even trauma in life. It doesn't mean that stress and adversity and trauma won't happen to you, because those things happen to everybody. It may not, your stress and adversity and trauma may look different from mine and vice versa, but it means that we're able to bounce back from it and not be torn down from it. We often, I wish I would have gotten a rubber band out of my desk drawer. I don't have one right now, but taking a rubber band and stretching it out, and it comes back to its original form. It doesn't stay the same. It doesn't break. It comes back. So resiliency is that. We're able to come back to that form. And it's a skill that we develop as we grow. It's something that as we become more, we learn the skills that we need as we grow from the adults in our life that are pouring into us. We develop resiliency. We learn the skills that we need. And all children and adults can work through the difficulties that we face through our lifetime because we become more resilient. And one of the many ways that we build resilience is by learning how to take care of ourselves. And another buzzword, that's what I was trying to remember earlier, buzzword, that's floating around the mental health world and floating around, social media right now, is self-care. Because we all have been So trying to figure out how to take care of ourselves during all of this. And self-care and resiliency go hand in hand, because we need to learn to take care of ourselves to become more resilient. And so children learn that from us as adults. And if we're not taking care of ourselves, we can't take care of our children.
Mm-hmm.
If we, if educators aren't taking care of themselves and outside the classroom, they can't take care of their classrooms.
Mm-hmm.
If people who are in other professions where they're working with children don't take care of themselves outside of their professions, they're not going to be their best selves working with kids. And so on and so forth. And
True.
even the most at home. And so we have to learn the ways that you can practice taking care of yourselves to build more resilience are by talking about and labeling emotions, by making time for relationships, and even doing that through Zoom, even though everyone's burned out by Zoom. Mm-hmm. Writing a letter to somebody that you've been missing. That's a great way to build into a relationship that isn't tech savvy. Write a letter to somebody. Practicing gratitude. Open up your phone a couple times a week and make a list of things that you're grateful for. Teach your kids that too. It teaches them to be thankful for what they have. Spending time outside, going outside at least once a day to just get a couple breaths of fresh air, even when it's cold. If you aren't able to be mobile, just sitting outside in a chair for a few minutes. That connection to nature and that vitamin D and that fresh air and oxygen is so good for your body. Mm-hmm. And prioritizing exercise if you're physically able to. Mm-hmm. Following a healthy diet and trying to sleep well. Sleeping well is good for your brain, and taking care of your brain is good for your mental health. So pivotal for your mental health to take care of your brain. And eating a healthy diet as well. Creating routines. Routines are really good for us as adults, but they're very, very important for children too. When a child's off of a routine, they're left meandering, trying to figure out what to do. And I have a 5-year-old son who will be 6 next week. And when we're not on a routine, he struggles. Mm-hmm. He thrives when we're on a routine, even if it's not a full day routine, but when we're on a routine, he does really, really well. So we try our best to stay on a routine. And when I'm on a routine for work or throughout the week, I do better as well. Mm-hmm. It just works for me. So it's really important for children. Taking a break throughout the day. That's really important for us as adults who are, if you're working from home or even not, taking a break to get up and stretch, to get some water, to go outside. If you're working from home, take a 5-minute walk. It's important to teach that to your kids who may be virtual learning, to take a break in between their classes. Kids take breaks at school. They should be doing it at home also. Mm-hmm. Practicing relaxation and coping skills. There's so many great resources online for that are free or that are inexpensive. So many apps, etc. You can just, spend some time on mm-hmm. Google looking around for that. And then lastly, having fun together. We are all needing to have fun together. It's important to laugh. Laughing is good for your brain too. And playing games and doing whatever makes you happy is really important. And I think another thing that's important for self-care is remembering it's okay to feel whatever emotion that you're feeling. And
you're right. What resonated with me with what you said is I like the fact when you say go out in nature. Sometimes I've heard this phrase vitamin N for mm-hmm. nature. And sometimes I find it very helpful for myself to unplug from the technology, to take a digital break in the world of Zoom and online learning, just to take a break from that and to go get my vitamin N while I'm getting my vitamin D. So I think that's really important. And one benefit I think children have over adults is children laugh more. Children have the natural abundance to play, which it seems to me, or studies have done a lot, that as you get older, you play less. So, but we can learn something from the children and learn how to play more, because playing is not about the result of doing anything other than the fact of play. There's no end result or end goal, just to play. So I think those are very important tips that you brought up, Tiffany.
Yep.
If I was going to say, you know, I think I know how you're going to respond to this, but what are the biggest mental health challenges children have faced in this last year, and how have these challenges impacted families?
The list is pretty long.
Mm-hmm.
I would say worry,
Mm-hmm.
anxiety, difficulty separating from parents or caregivers, stress, irritability, hypervigilance, difficulty concentrating, difficulty staying motivated, school refusal. There is a study that happened in October of 2020 in the United States, which surveyed parents, suggesting that about 27% of parents and roughly 14% of children were experiencing worsening mental health problems during the pandemic. Rates of distress were highest among families with young children who may have lost access to care, and among single parent families. In that study, they also knew that some communities or subgroups had been disproportionately affected by the pandemic, including under-resourced or minority communities, and children in those communities were at a higher risk for mental health concerns. And also children with pre-existing mental health concerns, children who had learning disabilities and or other challenges that required individualized learning plans, and children with medical vulnerabilities may experience greater adjustment issues or mental health concerns.
That's
a lot.
That's a lot. And I think about that, if a child is used to the routine of parents having to be coming home or being home, and then how we have with some schools now where there is some in-person, maybe if a parent has opted to, that the change of getting used to the new routine, what had become the new routine, and then changing again to get used to the other routine, that's got to be so difficult for children.
Schools provide so much for children. They are one of the most important institutions that address children's mental health. They provide meals, they provide support, they provide relationships, they provide mental health support, they provide books, they provide education, they provide friendships, they provide cultural exposure.
Mm-hmm.
They provide so much for children, and all of a sudden that institution has been removed in one way or another in a child's life and changed in so many ways and in so many times over this past year that the child doesn't know what to understand or predict.
So hello, sorry, this is Joy.
Okay. And so it's really hard for a child to go through that many changes for something that is such an important structure in their life.
Mm-hmm.
And they don't know what to expect next. It's almost it is a traumatic experience for them. And then it's going to change again, or they don't know when, they didn't get to say goodbye to their friends. They didn't get to say goodbye to their teachers, or somebody that they knew from school passed away. It's so hard because so many things are wrapped up in this one building. It means so much to them. And it changes constantly.
Well, I was thinking about that too. Also, when we talk in the realm of children, I mean, children, the lifespan of, birth to 18 is technically childhood. Although if you're, above a certain age, you're like, I'm not a child. But, there's also the fear of missing out. I think about my nephew who was in high school, missed his, well, senior year of high school, missed prom, missed senior trip, missed graduation. So there's a lot of that anxiety, as well as fear of missing out of important events. So this really has had a significant impact, and not to be minimalized on the child level. It's a very, very significant impact in the world of children, like you say, who like routine, who have had their routine and world upside down and adjusting to new routines. And they're going to have to readjust if school systems go back in the fall to an old routine, but a new old routine. So it's going to be like another series of adjustments for children, for teachers, for parents, to deal with this new situation of going back to school. So if we talk about Tiffany, so then what can we do to try to assist children in this endeavor?
So there are important people in a child's life, and I think the most important person are parents or caregivers in a child's life. And what you can do, parents and caregivers, are, you know your child best. You can talk to your child's healthcare professional if you have concerns about the way your child thinks, feels, or acts at home or at school or with their friends. That's the most important thing. You need to reach out for help, and there's no shame around that. And there are resources to get help. If you are a child or a youth, your mental health is just as important as your physical health. If you're angry, worried, or sad, don't be afraid to talk about your feelings. You need to find an adult that you know, love, and trust, and talk to them. There are plenty of people that you can reach out to. Even if it's somebody new in your life, there's somebody available, and we'll have resources available for you to access to do that. If you're a provider or somebody who works with children, early diagnosis and appropriate treatment based on guidelines are very, very important. There are resources available to help diagnose and treat children's mental health disorders. If you work in a school or you are a teacher, this includes bus drivers and cafeteria staff or janitors or anyone, librarians, anyone working with children. Again, early identification is important so that children get the help that they need. You can work with families and providers to get resources to share with families so that you can ensure that they have the resources and information that they need. And if you have concerns about families, about a child that you have access to, you can share with them the information that you have.
That's really important to know, that children can reach out to have somebody be the resource that they can talk to, that they're never alone, that there's always someone that they can share that with. I think that's really important, to be able to get what's inside out to somebody who is going to listen to you and try to support you in the mental health efforts. I know, Tiffany, that your organization does a tremendous amount of work. Can you just really briefly tell me what your website is, and maybe highlight some of the resources? I'm also going to put this on our website, which is www.pgcmls.info. It's going to be in our health and wellness tab. But if you can go ahead and tell any viewers about what your website is and what they can expect to find on it.
Sure. So our website is www.childrensmentalhealthmatters.org. We have so many resources available on our website. You can find one of the most valuable resources on our downloads page. So if you go to our website, there are toolbars up at the top, and on the far right, there is a tab that says downloads or resources. And under that, you can find the downloads page. And there you will find all the things that you can download. But on that page is something called our Family Resource Kit. And in our Family Resource Kit are fact sheets on the most common mental health disorders that children struggle with. And on those fact sheets are all the signs and symptoms that you can look for each of those mental health disorders, and other resources outside of our organization where you can do further reading and research about those, and where you can go to help. And also within that fact sheet are tip sheets on what you should do if you're concerned about your child, where you should go for help, crisis services for each county across the state, and more invaluable information about what you should do if you need to get help for your child. Even if you don't have a child that you in your family that you're concerned about, it is a great tool to download and save in case your child were to develop a mental health disorder, or a friend of your child, or somebody that you come across, a friend of yours has a child that you want to share this tool with. It's just a great tool to have in your toolbox. There is another toolkit that's very similar for educators there as well. Same information, it's just geared towards educators. We have telemental health fact sheets that were built in partnership with one of our partners, Maryland BHIP. And those sheets help families and providers and youth. There's fact sheets for each of those, and there's some available in Spanish about how to navigate telemental health. And then we also have other downloads and activity sheets for you to help have conversations with your kids about their mental health. There's lots to find on there. I want to point out that our campaign, the Children's Mental Health Matters campaign, is a co-collaboration between two organizations, between the Mental Health Association of Maryland and Maryland Coalition of Families. Both of those organizations have a plethora of resources to offer families and adults as well. The Mental Health Association of Maryland website is www.mhamd.org, and Maryland Coalition of Families website is www.mdcoalition.org.
Well, those are a lot of resources, and I'll definitely make sure that Tiffany, that information is also available on our website on a link so that customers will be able to have access to those resources if they weren't able to catch them through us speaking about them quickly, that it will be one click away for them. I want to thank you so much, Tiffany, for taking time to advocate for children's mental health issues. Children are really important, and if we think mental health is hard to deal enough with adults, tapping into to children is an invaluable experience. So thank you for giving us insight into what we could do to try to help the littlest people with their mental health problems.
Absolutely.
So I want to thank you so much, and we will be continuing our conversations about mental health issues. So maybe we'll talk in the future.
Absolutely.
Take care.